keep us informed of the best practices that we can apply in our day-to-day work and the health sector in general. This particular edition is so important, a very important issue in our healthcare, burnout, particularly as it relates to a very important segment of our healthcare delivery, the nursing. The nursing profession, as you know, they constitute in our various healthcare facilities, the hospitals, and they take care of our patients in large numbers. But despite that, they are also faced with challenges, which we must find a way around to address. So on behalf of our permanent secretary, I want to welcome all of you to this edition that is being co-hosted by the Department of Hospital Services, led by Dr. Abisola Adegoke, MNI, who will make our own remark shortly. And I also want to especially appreciate our guest speaker, Mrs. Becky Kehinde of the Center for Clinical Care and Research, who has been working tirelessly in healthcare excellence and clinical governance and supporting our various health professionals to improve on their skills, knowledge, and conduct in providing excellent care to the Nigerian people. Once again, you are all welcome. Thank you. Dr. Adegoke, over to you, ma.
Hello. Good morning, everyone. You just heard from the Director, Health Planning, Research and Statistics, who is the chief host of this sector-wide webinar. You're welcome to the 8th series of our webinar, and I think it's still okay to say Happy New Year to everyone. And so without wasting much time, we're going to listen to the Director of Hospital Services, who is the co-host of today's webinar. So Dr. Adegoke Emenaima, please, you can take the floor. Okay, so while we're waiting for her, just want to remind us of some of our ground rules for this webinar. Please kindly use the chat feature for your general comments and questions. For engagement and interaction, you can use the raise hand feature on the webinar page. Then we'll also be taking Q&A at the end of the question block. Please use the Q&A session. We might not be able to allow everyone to speak because of time. And so those are some of our ground rules for the webinar. And please kindly indicate the organization where you are working so that we can address you appropriately. Thank you. Okay, so they are waiting to give her access as a panelist on the platform. I think we'll go ahead to introduce our speaker for today so that we don't take much of your time. As soon as the director is online, we'll give her the floor to give us her remark. Please, Secretary, can we have the slide deck on for everyone? Okay, so we'll be listening to our keynote speaker today. Please, can you move the slide to the citation? The speaker's citation, please. Thank you. So this morning we'll be having Nurse Becky Kehinde talk to us on tackling burnout and boosting retention in Nigeria. Nurse Becky Kehinde is a seasoned nursing leader and public health expert with over 3 decades of nursing service in Nigeria's healthcare system. She has extensive experience in clinical practice, education, research, and health program development, with a focus on HIV care, infectious disease, and sexual and reproductive health. Working with the Center for Clinical Care and Clinical Research Nigeria, she led the Nursing Leadership Initiative, PEPFAR Project, where she mentored and empowered future nurse leaders. Nurse Kehinde has also led major projects, including ACE4, an award-winning professional. She's recognized for her commitment to strengthen health systems through innovation and evidence-based practice. So join me to welcome Nurse Kehinde, Nurse Kehinde, as she takes us on nursing in Nigeria, tackling burnout and boosting retention. You are welcome, ma'am.
Thank you very much, Madam Bosede Arogundade. Great nurses, good morning. The distinguished ladies and gentlemen, I want to appreciate the DHPRS. I also want to appreciate Dr. Adegoke and the entire Federal Ministry of Health, Social Welfare staff for this great opportunity. I count it a privilege. And I also want to say Happy New Year. Great nurses, the topic of discussion today, as we have been told, is tackling burnout, boosting retention. I hope you can hear me.
Yes, ma'am, we can hear you.
How many of us have suffered burnout before? That's the question for us. If you have ever suffered burnout as a nurse, please click yes or no on the chat box. Thank you very much. I am a survivor of burnout, and that's why this topic is very interesting for us nurses. And I want to say thank you to the organizers of this webinar because this is quite timely. You will all agree with me, since the Japa syndrome started, we've had acute shortages of nurses and other professionals across all our health facilities. And this is very, very worrisome. Today, our overview will be looking at what burnout is, what is professional fatigue, and what is the situation in the nursing workforce in Nigeria. We'll also look at some studies that have been done in country and outside about burnout among nurses. We'll also be able to discuss what the factors are that are contributing to burnout. Then some people could be stressed and not know that they are under stress. How do we know when we are stressed, and what are the feelings that we have? So, as burnout have a negative impact or positive impact on nursing care, we're also going to look at that. And for the way forward, we do not want to identify a problem without a solution. How do we hope to boost retention in Nigeria? How are we going to support the nurses to have emotional well-being? So we all have a part to play, the nurses themselves, the leaders, and the policymakers. So together, we are going to tackle this. So welcome on board and thank you for joining. Great nurses, I love you all, and I'm proudly a nurse. Next slide, please. So what is burnout? In 2019, WHO defined burnout as a syndrome that is conceptualized, resulting from a chronic workplace stress, if not properly managed. But prior to that, burnout was used to describe the state of being helping professionals such as nurses and doctors. That was in those days, back in the 70s, who are in this kind of profession. They felt burnout is just for nurses and doctors who are working. But we've come to agree that even individuals, the general populace, can suffer burnout. So, and under that, they were able to identify 3 main symptoms. I think there's a typographic error on that. They noticed that when you are burnout, you have reduced professional productivity. You don't tend to work like you ought to. Perhaps you are supposed to manage 10 patients appropriately, maybe do ward dressing for them, their medication, oral care, and so on and so forth. You are not able to carry out all of these activities successfully. Another thing that can happen is you are tired, you are feeling exhausted, no energy. And again, you are feeling unwell, you are feeling bad. Why am I in this career? This career is so overwhelming, and that leads to mental imbalance. Next slide. So when we talk about burnout, beyond fatigue and professional crisis, we know that when people are burnt out, they have physical exhaustion. And this is a study that was done by Masler later in 2016. In these studies, they noticed that when people are burned out, especially nurses, they have what we call reduced personal accomplishments. You begin to feel, am I fulfilled professionally? Is this where I'm supposed to be? You begin to question your integrity, your productivity, your career productivity. At that point, know that there's a burnout. Again, in Nigeria, there was a studies by Abiola et al. In 2021 that shows that lack of psychological support, chronic understaffing, and working for long hours was linked to burnout. That's a study that was done in Nigeria. Then 2009, there was another great study by Shields and Wilkins, which identified that burnout is associated with low quality of care, increased errors, and people want to quit their jobs. So these are studies, evidence-based studies, that have shown that professional burnout is real. So we need to talk about this, we need to be conscious of it, and we need to solve this. Because we are sitting on time bomb, I'm going to be talking about the Nigerian situation shortly. Next slide, please. So let's look at the workforce in Nigeria. These are other studies that was done by two people in country from 2018 to 2020. If you look at the first one, 65% of Nigerian nurses experience burnout. That's by Afolabi et al. That was a study that was done. And the same Adewale did the same survey and discovered that emotional exhaustion was identified in 45% of the cohort of nurses they did those studies on. In 2020, another one was carried out by the same Adewale, and also this time they report a lot of depersonalization, feeling of dejection, regret, and exhaustion working as a nurse in Nigeria. So you can see the percentage. It's nothing, it's something very, very crucial for us to look at. 65% of that cohort is huge. You can Google it, you see it online. So what are those factors contributing to burnout? The first one is heavy workload and inadequate staffing. Recently, we walked into a hospital seeking for medical attention for somebody, and we were there for over 1 hour. We were sitting, waiting to see the doctor. They said the doctor was in the theater. The nurse came out. Okay, can somebody check vital signs? I said, please, I can help you. I'm a nurse. Can I? I showed my ID card. She said, please, ma'am, come here. You're not supposed to do the vital signs for me. I said, okay, I excuse you. Before we knew it, she went upstairs again, and we were there. Assuming I was not a nurse attending to that patient we went through with, you can see. And she came pleading. They are understaffed. How can a nurse be the one at the OPD as well as seeing the inpatients and going upstairs to see clients? So the heavy load is much. Those of us that are bedside nurses can attest to this. What about poor working conditions? You are in a facility. There are hospitals that nurses don't even have enough chairs to sit. If there are many on duty, you see one going about. Some of the chairs are broken, no good working tables, no biro to write. So many things, you can go on and on. What about lack of resources? As a nurse, you went to school, you've been taught bed making. Cardiac, you want to make a cardiac bed, you know you need extra pillows to prop up your client. Even the bed, you cannot put a client in cardiac and upright position with it because the bed is also bad. So the nurses get frustrated at one point working. I want to talk about limited career advancement opportunities. Nurses, beg your pardon, some nurses have been marginalized and reduced to the background because they cannot advance in their career. They come as RN and they work for years, no promotion, because they've not gone for trainings. Some are there, they are doing the same work, no training. Is the obsolete knowledge that they have, they are still carrying on. So we can go on and talk about this. How about poor remuneration? I was in a state recently to conduct training for nurses, and to my dismay, a nurse that has BSN qualification is receiving 50,000. I and my colleagues were moved to tears that day. And The head nurse told us, this is one of my best hands. Yet that guy is receiving 50,000 naira. You can go on and on to talk about that. What about lack of recognition and respect? In the health sector, we have different people, professionals in the team. How are nurses perceived? Labeling, wrong labeling, competition here and there, unhealthy rivalry. These are some of the things contributing to burnout and stress in the working environment. Next slide. So having talked about the factors contributing to that, how do you know when you are stressed up? If you have ever had this experience before, some people feel tired. It starts like that. They lack focus. Some get angry, and that's when they say, that nurse is wicked, forgetting that he or she also is a human being having blood running in his or her vein. You also have difficulty in sleeping. Others have loss of appetite. And sometimes, nature has it that if you are depressed and you are not positive, you keep seeing the bad side. And many of these bad things that have happened in the past now come to the future. And before you know it, if care is not taken, that person can go into depression. So these are some of the feelings you have and what we do, what we exhibit when we are stressed. Next slide. Again, as part of the signs and symptoms that one could have, there's what we call psychosomatic. When the mind is sick, it can exhibit some symptoms physically. And also complaints like headache, I'm having neck pain, shoulder pain, oh, I don't even have appetite, I'm feeling sad and blue, nothing seems to interest me, it's as if I have my chest will burst out. People complain of all this. Others, people find rashes on their body, they begin to have bowel irritation problems, and so on and so forth. So when people exhibit all of this, know that that person might be going through stress or burnout. So you need to do something about it. And I want to say at this point, how careful are we to observe our colleagues at work? As a nurse head, what do you do to assess your colleagues at work? Do you know them? Do you ask them questions about their personal life? Not because you want to gossip or you want to relate it to another person, but genuinely you are concerned because you know that if they are sick or if they are burnt out, it could lead to inefficiency at work, which will affect every one of you, whether you like it or not. So we'll be looking at what the impact of burnout on nursing care is and how do we address that. Thank you. Next slide. So when you talked about impact of burnout, it's enormous. It's huge. We can go on and on to talk about that. But I want to start with the negative impact on nurse-patient relationship because that is the overall umbrella that the society sees and the labeling starts. That nurse is very hostile. That nurse is unfriendly. That nurse is wicked. Because when people are burnt out and it is not addressed, that happens. Because she's not smiling, she's sluggish. When the patient calls, she's unresponsive. That labeling starts from there. What about medical errors? You find out she's supposed to serve 1,000 milligram of paracetamol. She's giving 500 milligram underdosing, or she doesn't even check the expiry date. So medical errors starts, patient safety is neglected. What about decreased job satisfaction and morale? She begins to feel, am I in the right profession? Why am I even here? To hell with the work. If I don't do it, let the patient die. I'm also a human being. It could get to that level if not tackled on time or treated. So when people are burnt out, you also notice that they take excuses. Today I'm sick. Tomorrow, I want to go and see the doctor. Next tomorrow, my child is not feeling well. I can't come to work. And over time, you have increased turnover rates because the organization may not be able to tolerate that type of staff any longer. So they will say, okay, can you step down? And they now have to employ another person. Again, recently, we were just in a meeting and somebody called that 3 people have resigned in a month in that organization. And my boss was quick to say they need to do a survey. And I put a call to one of those that resigned in that organization. I collected information, just wanted to know. Out of curiosity, I discovered the environment was toxic. All the 3 that resigned do not have another job to take. And one of the ladies spoke to me and said, if I continue to work in that organization, ma, I will die. I don't want to die. The environment is so toxic. There's work overload. People are not being appreciated. Those are powerful words. And I'm going to follow up on my boss, who happens to know some people there, to talk to them in that organization. That doesn't speak well of such organizations. How about decreased quality of care and patient satisfaction? There's something we do in our organization. We do patient satisfaction surveys in HIV care. All the IPs do that. And what we do is to apply series of questions to is a questionnaire, and the clients will respond to that. At the end of the day, they collate and they share the results with us. That's a good one. And personally too, I've taken time to meet some people that I work with. Please, I want you to to give me feedback. How am I doing? And people do that. We do it in the family too. We ask my children, what have I done well in the course of the year? So do that this thing. We'll come to talk about that. So let's move to this next slide. We can see that the impact of burnout on nursing care is very, very important for us to look at so that we can profile solution. The impact is huge and it is negative impact most often than not. So how can we boost retention in nursing? In the face of JAPA, we have seen, if you go to Nursing and Midwifery Council and they give you despite Trump's restructuring in the United States of America, nurses are jackparing every day. I wish somebody can be at the airport to take that survey for us. Let's know the number. But I can tell you it's still on the increase. So we need to do something. We cannot continue to complain. If you look at what I have on my slide, competitive salary and benefits, please look at that. Well, it's there, but that may not be possible. Why am I saying this? Can you hear me, please? I am not a prophet of doom, but we know what the economy is like. So when you talk about competitive salary, yes, it's a good thing to do. But I will talk more about benefits. There are benefits that you can give. You can say, okay, can the organization save money? It could be just end of year appreciation for your staff. Even if it is plastic cup you buy, if it's coming from the management with love, it can be a plug that you buy. Show them, give them benefits that are not even monetary too. They will appreciate it. If they see it in their homes, oh, they will remember, this is a reward for my good work. So please, we need to note that. And again, opportunities for career advancement and professional development. This cannot be overemphasized. And I want to say this, please, nurses, be intentional about your career growth. I appreciate the organization I've worked because at least they've developed my capacity to a large extent. But I also have my own part to play. Why am I saying this? The government do not have the money to send everybody to school. So we have to consciously save and be intentional. You need your primary short-term career growth, the long-term goals. If you want to be a PhD nurse,
Hello, ma'am. We've lost you. Please hold on. I guess it's network issue. She'll be right back. The speaker is off, and I'm sure his network. She'll be right back to continue um the topic. Okay. So while we're waiting for the keynote speaker to join us back, I want us to know that this sector-wide webinar is being hosted by the Federal Ministry of Health through the Department of Health Planning, Research and Statistics. It's open to all departments, all health agencies, and it's open for anyone. You just have to reach out to the Director, Health Planning, Research and Statistics with your topic. And the purpose is to showcase what we are doing in the Ministry of Health across our agencies and departments. So at teaching hospitals, you're welcome to use this platform to reach out to Nigerians on what you're doing in your place of work and other things. It's for everyone in the health sector, and you're welcome. This is the 8th in the series of our webinar. We've had about 7 webinars last year, and incidentally, this is the first one, and it's on nursing and burnout. But it's not only nurses that experience burnout anyway. So I also did not introduce myself before the webinar started, and I've seen that we have quite a lot of participants from across all our institutions, all the federal tertiary institutions, even private in attendance. We've been receiving your addresses, and some of our director nursing services, MDs are also on the call. So you're all welcome, and we appreciate. We'd like you to, you'll be receiving mails from us subsequently on other webinars that are not also, that is not just for nurses, but for everyone in the health sector, so that we are abreast with information on what is happening at the Federal Ministry of Health and across the health sector in Nigeria. Thank you. While we wait for please hold on while we wait for our hosts to come back, our speaker rather, to come back.
Oh, sincere apologies for the network glitch. We've had to change to many networks.
You're welcome back, ma'am.
I sincerely apologize for that interruption. Thank you so much. I sincerely apologize for that glitch. So before the network interruption came up, we were talking about boosting retention in nursing, and I was talking about opportunities for career advancement and professional development, emphasizing that we need to be intentional about our professional development. We all know that the government is cash strapped, so people have to make efforts and conscious efforts to save. So I gave an example of what you do in my office, the monthly contribution. So instead of buying Ashwebi, buying latest designers, if you know you want a career progression, you need to save for your school. Who is your mentor? Make conscious effort to do that. Identify somebody that can mentor you. Today, I always talk about one of our nurses. I met her as a nurse in Afikpo, in School of Nursing there. Today, she has a PhD. She is doing geriatric nursing today. So I met her and I picked her up as a mentor. Today she's my she's my as my mentee. Today she's my mentor. When I call her Dr. Amara, I have quite a number of nurses like that. Some are in the US doing so well. I'm proud of them because they, from day one, they identified what they wanted and they were going for it, irrespective of the opposition they were facing at work. We know that we are in a competitive environment and you must shine. And for you to shine, you must study to show yourself approved. When doctors are talking, what stops you from talking? They are doing word rounds, they're asking you questions. Don't carry folders and follow. You have to talk. And you just not do babbling. You have to speak as a nurse, evidence-based, scientific nurse. That is a word for another day. How about safe staffing ratio and manageable workloads? I'm going to talk to our leaders later in the next slide, but I also want to say, please, if you learn to say no as a nurse, if you think you are overwhelmed, you can make a case and they will look into it. Don't be grumbling. Don't go and gossip about your head nurse to another person. The communication is very key. And I keep saying it. We are trying to rebrand nursing. And one of the issues that has been identified is that we do not communicate. A client come into the hospital and saying, I'm going to the lab. Nurse, please, where is the lab? There. You are pointing, that there you are saying is pointing to many places. Oh, thank you for asking. The lab is still like 500 meters away. It's still a bit far. Well, you see that person standing wearing red cardigan. When you get there, you can ask. They will link you up. It's just a straight road. You turn left again. But as you are going, be asking. The person will be, but here, then you are transferring aggression. It doesn't work that way. So for us to boost retention, we need to look at all of this. Begin to recognize rewards for outstanding performance. There are people who are doing great in their profession. I go to some hospitals and I'm tempted to say, please, you must give this person an award. Last, when we did our NLI, all of you that were part of this, we attest. I have a gift box. When you answer question or you do well, we give gifts. And again, we also personally be mindful and conscious about our mental health. If celebrate yourself, buy a card. I do that. Walk into a shop and buy a card. Thank you, Nike. I love you. Love yourself. You write, Nike, you are a smart girl. Nike, you are beautiful. You are wonderful. You are a great nurse. Say affirmative things to yourself. Journaling. You had a good day. Write it down. On the 4th of April, I did this for a client, and I'm so excited that the client came back appreciating me. You give thumbs up for yourself. You need to give yourself a treat. Don't be working every day without rest. Year in, year out, you are a nurse. How many times have you taken time to go to point and kill? Ask them, Malam, kill fish for me. Grill it. Sit down and eat with your spouse or with your children. Those of you that work with me know that I do that. I give myself treats. Sometimes I get some money, I'll go to the market, buy something for myself. And I do that intentionally. It gives me joy. It makes me happy. This is a little reward for my work. And I'm recognizing myself. So for organizations, they need to give awards. They need to have received so many awards to the glory of God. And that gingers me to do more. Some, I don't even know those that nominated me. So please, organizations, reward your staff. Give them that recognition. It could be a plug. You can do a plug of 4,000, 5,000. Give them. Support them. we have chin chin and she was smiling. She to give realize it. But these are things that boost people's mood. You say, hey, so madam likes me. And they to give. So support for mental health. Do we have a mental health? This network, I bind you. So do we have a mental health specialist in our offices? Okay. Hmm.
Hello, ma.
Okay, sorry. So do we have a mental health specialist in our organization? If we do not have, we all have different strengths. In hospitals, I know tertiary hospitals have this. So please, we should identify somebody who will be the mental health focal person that people can talk to, people can, confide in and discuss mental health issues. And we should always listen as um, we should always listen when our subordinates bring up mental health issues. Next slide. Let's quickly look at what we can do again. So, talking about support and well-being. So, if we are going to boost retention, we have to also have what we call peer-to-peer support groups. When we started HIV counseling, there was a time we did a training in Kaduna, and we saw the need for us to come together as counselors. So I decided to set up that group, and we were doing well. We even refer cases to one another. But later, when I was transferred out of Abuja, that died a natural death. It ought not to be. So back then, we used to even refer cases. We talk to ourselves, oh, this is what I'm experiencing in my own organization. So that can go a long way. Next slide. So another thing we need to do when we are doing our monthly meetings, either professional meetings, we need to also create time to do that of mental health, which will integrate that. Especially, we can do something like self-care and stress management. In my organization, we, just contribute little money, as low as 1,000, to bring in an instructor. We do salsa dance. They taught us how to do. We have a gym that we go to. So all of this wellness can also ease off stress. So when you dance, when you laugh, you see other people, it can also relieve you of whatever stress. I've talked about communication, very, very key. We should try and establish employee assistance programs, things that can help our staff, our subordinates. There's one we do end of year party. We ask people to bring their children and their husbands so that we can wine and dine together. Your children can see your colleagues. And we saw some of them when they bring them, they say, oh, this is Mommy Nike. Oh, thank you, Mommy. Maybe, so it also helps them to know the environment their parents working. I've had to talk to some kids. I say your father is not always on ground because he's working. He wants to pay your school fees. He wants you to ride a bicycle. Your father wants to buy a car for your mom someday. So he needs to work. And children are excited to hear that. Daddy is not happy that he's leaving home. So because remember, I forgot to say this. If the home front is not peaceful, there will be transferred adherence, aggression at work. So that person will begin to exhibit some qualities of burnout, or you see symptoms and signs that all is not well. So we have to deal with the home front too. So you make it encompassing. Next slide, please. So for healthcare leaders, I've talked about this, and I'm just going to reemphasize that we need to provide resources and support mental health, prioritize the well-being of nurses and the retention. We also have to foster a positive work environment by creating fun at work. You can buy biscuits, but bring water as they are working. You are busy, but you can just take some water. Onyinye, I noticed you've been working since you've not taken anything. So in one hospital, I heard of a nurse that collapsed, and it has happened to me before. You take food to ward, and you are so busy, you are working to the point of collapse. So what are we talking about? Encourage open communication and feedback. Leaders, learn to listen. Communication is two-way. Let them give you feedback. How are you doing as an organization, as a head nurse, as the DNS? What do you think you are doing well? You can do a survey, anonymous. You keep suggestion box. Let them give you a constructive feedback. At that end, you'll be able to make amends where you need to. I've overemphasized the need for recognition and for outstanding performance. Let's do this. Let's celebrate our wins. Let's celebrate nurses. And I know that when we do that, nurses will be empowered to do more. And they will be happy. They will be more productive. So for our policymakers, this is a passionate appeal. Next slide, please. There is no problem without a solution, except we make conscious efforts. Except nurses are at the table. It's disheartening when issues relating to nurses are being decided by other professionals. As we speak, we do not have a department or directorate of nursing at the ministry. We are begging. It's an appeal. Please help us develop policies that promote nurses' retention and recruitment. I want to appreciate what the government is doing. I know they are recruiting, but they need to do more. I also want to appreciate Nursing and Midwifery Council and NAM. I know that this year they've shot our target for admission, and I'm privileged to be part of the strategic direction for nurses and midwives. A lot is being done, but we need to do more, and we need the support of policymakers. Encourage nurse leadership and participation in decision making. He who wears the sneakers know where it pains. So we know that they are trying, but they need to support us more. We want to be at the table. We do not want to be behind, and somebody else is coming to say, for you nurses, this is what they want for you. We know our profession. We want to work with others. Holistic healthcare can be achieved through partnership, and professionalism must be followed through when everybody is carried along. So we need you to provide that support for us. Let's develop policies that will promote nursing. Improve working conditions and resources. Give room for nurses. When they are due for promotion, people work. I've suffered that, working for 4 years, no promotion. Even after going to school, you expect that some will have their qualifications ready, they are not being promoted. I have a lot of issues on my table when we go to facilitate in some organizations, somewhere you cannot talk, in the military and so on, and people are dying in silence. Let's fight for our rights. We are not going to fight as a physical fight. Make passionate appeals. Invest in nursing workforce development. How many organizations, how many policies support nursing research? We need money to be pumped into nursing. Remember, nurses account for more than 50% of the health workforce. And if we do not attend to our issues, We pray that someday we don't get to the hospital and there are no caregivers. The caregiver will give care to themselves, but we also need policies that are favorable to encourage nurses. As a nurse, I want to leave you with this word. What are you doing? What are you doing to change the narrative? What are you doing to ensure that nurses are not burned out where you are working? Are you going to do research to change the narrative? What step are you taking to make sure that your name is written in gold when you leave that establishment? Burnout is a significant issue, whether we like it or not. We need to address it. We need to address it critically for us to promote retention. And if we do not invest in nurses' well-being and career development, we may not get the quality of care that our patients require. And I want to say thank you so much to the Federal Ministry of Health. Most grateful to Dr. Adegoke for this privilege, the crew, and I want to say this is the end of our discussion. It's time for questions.
Thank you very much. Thank you so much, keynote speaker Nurse Nike. In fact, I've learned a lot, but my own aha moment is that we can actually make contributions for our career development, and that is amazing, instead of buying our shebi and wrappers. Anyway, while we are getting our questions and answer ready, I'd like to welcome the Director of Hospital Services, Dr. Adegoke MNI, to give us our remarks.
Hello.
You are welcome, ma.
Thank
Good
you.
morning, ma.
Good morning.
Good to see you again. Happy New Year, ma.
I wish you same. Thank you. Thank you. And please permit me to register my apologies. Okay. I actually started the meeting with us from the onset. I was here when Dr. Arogundade was saying that, so let's continue while we await the Director of Hospital Services to join us. Also, the recitation, fantastic, was read out. I was here. But you see, Director Planning, Research and Statistics, they have the key to open the door. But somehow, it was difficult. So really, I am very sorry. And then I'm also very grateful to be a part of this conversation. I want to thank and appreciate. Is there an echo? Or can you hear me?
We can hear you, ma.
All right. So I want to thank our seasoned nurse, Nurse Becky Kehinde, who is also a public health expert, for that wonderful presentation. I enjoyed it because I'm right here, as a silent listener. And so I want to say good morning to us all once again. I want to say good morning to our distinguished participants, respected nursing leaders, colleagues, and partners in healthcare. I'm aware that we have a number of our people from the federal tertiary institutions, also those at the subnational and the local government, join us for this important webinar. You can see somebody just commented, very impactful. Thank you very much. And really, from my own end, I can also say thank you for this wonderful presentation. Anyway, as God will have it. This, I'm supposed to have given the opening remarks, but now it has turned out to be a closing remarks. All right. No thanks to technology, but it can only get better because I've also told them in the department that going forward, we must have, you know, a what now? That we also, the office of the director of hospital services would also be used, as a point for the online participants. It will help us to be able to, some of these teaching problems that we experienced this morning, that have been supplanted if, that had been the case. Anyway, this is the first time, and by the grace of God, I promise us that it can only get better. All right. Thank you very much. So I'm Dr. Abisola Adegoke, MNI, Director, Hospital Services. And on behalf of the Honorable Ministers and the Permanent Secretary, I want to say thank you all for being a part of this webinar this morning. Brilliant presentation, fantastic, and practical, because as she was relaying some of the instances, I could relate, and really I say kudos to our presenter. I'm not in any way surprised because she's seasoned and she's done this so many times. And so I want to say thank you, ma'am, for that. Without saying much, I want to say that we have all benefited from this presentation this morning. Though it is coming from the nursing division of the Department of Hospital Services. But you all agree with me that what has been said here this morning, you don't have to be a nurse to get, stressed. That's the truth. As far as the health system is concerned, the demand is so high that if you must give it what it takes, if care is not taken, you can get, And so I want to believe that we have all benefited from this conversation this morning. And so let's give it to the nurses, because we know that they play a critical and very significant role in our healthcare delivery. And the initiative to address burnout and retention and other topics as we go on in this monthly webinar meeting, it's so important. It emphasizes the need for collaboration, for professional development, and importance of evidence-based approaches that is targeted at improving the healthcare delivery system. And so the platforms like this will provide a vital opportunity for shared learning. It will also encourage professional growth, strengthen teamwork among nurses and other professionals as far as our health institution is concerned. And so, on behalf of the coordinating minister, Honorable Minister of State, and the permanent secretary, I want to appreciate the nursing division for putting this together. I want to appreciate the head nursing services, Didi Ale Oluwayomi Lucia, for her doggedness in ensuring that this webinar, took place. I also want to appreciate the thoughtful process that has gone into organizing this session. And I want to assure us all that the ministry will continue to have the interest in supporting, this initiative and others that is aimed at tackling burnout, boosting retention, and other areas of interest, which remain a priority to us as far as hospital services is concerned. Now, I want to thank the Department of Planning, Research and Statistics, ably led by Dr. Camille Shoritire. I want to appreciate our head coordinating unit, Dr. Arogundade, Bosede. She's done so well also anchoring this meeting this morning. I want to appreciate the department again for the guidance towards the strategic development and policy direction implementation of the ministry. This is all geared towards strengthening our health system. I want to appreciate you for standing with us as we work collectively towards improving healthcare delivery and sustainable progress in healthcare services in Nigeria. I want to thank the organizers. I want to thank every participant for your time. I want to thank those of us also from the ministry and those that have joined us. I believe we've had a wonderful session this morning. And I want to charge us, whatever we have learned from this webinar this morning, I want us to put it into practice, because that's the whole essence of having this conversation. And going forward, I can just assure us and tell us that it will continue to get better and better. So please keep faith with us. All right? Thank you very much for this. Let's do this again. Yeah, in next month. Thank you very much. Have a nice day. Thank you. Dr. Arogundade, please over. Thank
Good.
you.
Thank you so much,
Process.
man.
Thank
Not
you.
so fast. We are so honored the PAMSEC wants to speak to us. So, um, so please, everyone, just give us a minute to make a panelist so that the PAMSEC, Federal Ministry of Health, Ms. Daju Kacholom, MNI, can address us this morning. So just give us a few minutes. Thank you. We'll be right back.
Okay. I want to.
She is here. So we have the honor this morning to hear from our permanent secretary. Ma'am, please, you have the floor. You're welcome. Thank you, ma'am.
Good morning, everybody. I am surprised. I'm just.
Good morning, ma.
Make my own comments. Other than that, I wasn't going to make any comment. However, my dear panelists and our presenter, fantastic presentation. I listened to you, Nurse Nike, and I'm happy that you are part of the Federal Ministry of Health, because you are one of those who is putting together all the policies that we do in health. But I listened and I heard, and I'm happy that the Director of Hospital Services has spoken on our behalf, and she spoke very well. Burnout is not just for nurses. I'm not a nurse, I'm not a doctor, but I'm definitely burnt out working in Federal Ministry of Health, because the load of work in the Federal Ministry of Health, the quantum, you can't even talk about it. And as you were talking, I realized that, yes, I am so stressed, but I didn't realize I was that stressed. So as you were making your presentation, I was ticking off. And I think I deserve an accolade, because for 2.5 years, and I'm still standing on the Federal Ministry of Health. Dr. Adegoke, I'm happy you're laughing. You know the truth. I think that we've done well. We've all done well. We've all done well. And to the director, nursing. I know there have been calls and calls for making nursing a directorate. Let me put it on the record here and now so that it does not keep coming up. That has already been addressed and put to rest. For all the nurses, we do not in any way not appreciate the work that all the nurses do. It's not that every cadre must be a directorate. No, there is a division headed by a director, full director. So any policy that has to do with nursing will still be brought up under the Department of Hospital Services. We are here to work for Nigeria and for Nigerians. And I want to thank the entire health sector, because without you, we will not be where we are. Today, we're talking about the nurses. We're celebrating the nurses. And I hope you know that there's a Commonwealth Summit coming up for nurses. Commonwealth Summit of Nurses and Midwives. And it's taking place in Nigeria. And we all have to work together to make sure that it is a successful summit. So I'm hoping Director Hospital Services, alongside the National Association of Nursing and Midwives, the regulatory body, that we all come together to showcase the world and tell the world that even as Nigerians, that our nurses and our health sector are actually working very hard, that our health indices are improving. Because when they talk about health indices, Nigeria is way back there. But in the last 2.5 years, we've improved, whether in nutrition, whether in maternal mortality, emergency cases. I'm sure that we're all proud of ourselves. And as Federal Ministry of Health, I'd like to say to Health Planning, Research and Statistics that ever since this webinar series started, it's been fantastic with different topics each month. And I've actually escalated it to the Office of the Head of the Civil Service of the Federation. So I would like it, Dr. Shoretire, that when next there is the webinar coming up, that you give me enough notice to forward to the Office of the Head of the Civil Service at least 2 days prior, so that they equally join, because I've actually informed the Head of Service and the entire body of permanent secretaries that this is what we do in Federal Ministry of Health, and they actually are looking forward to being part of it. So I'd like to say thank you, Director Hospital Services, all the distinguished heads, panelists, participants. I saw the DG Blood Service Commission. I know you have an event today. Thank you. You started yesterday. For all of us, the nurses, non-nurses, administrators, it's been a fantastic 1 hour plus. And I wish us all a blessed day and a happy new year. God bless us all. Thank you.
Thank you, ma'am.
Thank you so much, ma.
I'll just confirm from.
Thank you. Thank you, Ma, for joining us this morning. Thank you,
Thank
Director
you,
to
Bosede.
Services, and all our DG, CEOs, and everyone that joined the call. We'll send information on the next webinar. Thank you so much and have a blessed day, everyone.
Bye.
I said they can drop the questions in the chat box.
I was observing the chat, but they didn't drop questions. They already
Thank you. Thank you. Thank you so much.